Well, the medical community in North Idaho is dealing with a situation we've never seen in Idaho. 10 hospitals are under that crisis standards of care, doing their best to keep up with an influx of very sick COVID patients. Today, we waded a little deeper into uncharted waters with military medical personnel from the Department of Defense dispatched to North Idaho to help. So we've gone from asking Idahoans to do the right thing to asking the federal government for help because, well, not enough of us have. Joe Paris shares details on what the role of the Department of Defense will be, how long they're expected to stay and help, as well as insight from staff at Kootenai Health on how this is going to help most.
A day after crisis standards of care was implemented in North Idaho, medical personnel from the Department of Defense are on the ground to support hospital staff at Kootenai Health. Major Ian McInnes, a pulmonary and critical care physician, details the 20-member team he is a part of.
We're mostly comprised of nurses. We have several doctors, and then we have a few respiratory therapists as well.
So what will the personnel be doing at Kootenai Health? A major goal is to simply fill gaps in resources.
Provide some much needed offloading of that stress on this local system, hoping to be able to provide a little bit of room to breathe so that the folks who have been here fighting the battle against COVID for the last months and year can have a moment to sort of regain some rest and continue the fight alongside us.
Kootenai Health leaders say in recent weeks, staff have worked long shifts and extra days just to get by. Dr. Robert Scoggins, Chief of Staff for Kootenai Health, says his support couldn't have come at a better time.
Our staff was stretched to the limit of how many patients we could care for as physicians and also nurses. The ICU nurses that they brought are now helping us relieve some of the stress from our ICU nurses and other nurses in the hospital.
Even with the help, the reality remains. The health system in North Idaho is under heavy pressure as healthcare workers treat very sick COVID patients.
The resources that we're bringing in now helps to put a dent in that for sure, but we are still short and we will still continue to stretch our staff thin or use different team-based models and other means to offer the care that we can for our community.
The Department of Defense mission to Idaho is set to last at least 30 days. There are hopes that the situation will improve by then, but medical leaders are calling on the North Idaho community to do what they can to help keep people out of the hospital with COVID. Things like masking, physical distancing, and vaccinations are extremely encouraged.
I mean, this is a virus. It just doesn't care what you think. What it cares is that it has people to infect, and right now our community is allowing that infection to go. Pretty much wild.
Major McInnes says that the team will do what they can to take on as much as possible while serving their mission, but that doesn't change what North Idaho medical personnel have already been through and continue to go through.
Emotional trauma that the nurses see day after day it wears on you over time. And really, we've been doing this for, like I said, a year and a half, and our unit's been open for over a year, and that hasn't changed.
All right, Joe, I know that some of the counties up there in North Idaho affected by these crisis standards of care have some of the lowest vaccination rates in the state. And some of the questions we're seeing about this has to do with, well, this is obviously because of the vaccine requirements at the hospitals, but as we learned yesterday, that's not the case.
Yeah, Brian, there's no vaccine requirement at Kootenai Health or really up north at all. So for people saying that this entire situation in North Idaho could have been avoided if the hospitals didn't have a vaccine requirement, you're wrong in saying that. That's simply not the case here. When you talk about the vaccine percentages and the inoculation rate up north, Idaho County in North Idaho, and if you look really north of Idaho County up to the border of Canada, the vaccine rates by county varies between 30% all the way up to 53%, being the highest there, Brian. So really the highest percentage you're seeing anywhere in North Idaho is only about half the population is vaccinated. That's why the team at Kootenai Health is asking for the community's support. They say that we need you to do whatever you can to keep you and your loved ones out of the hospital with COVID. One thing they continue to point to, though, in North Idaho, Brian, is that there are not the mitigation efforts up there that experts wish there were.
And a lot of those hospitals under this list of 10, the rural hospitals, kind of clinics in some of those cases, and everybody just gets funneled to that Kootenai Health because it's, well, the largest in the area. All right, thank you very much, Joe.